first, I want to take a quick update on testing and hospitalization, which I think, as most people know, are some of the key metrics we're paying a lot of attention to. Yesterday, almost 12,000 tests were reported, a big number that was double the previous day's total, which brings our total number of tests conducted in the Commonwealth to over 350,000. Of the tests reported yesterday, 14% were positive for COVID-19. That percentage is much more in line with the trend that we've been seeing over the past week, where the percent of cases that are positive has been lower than pretty much anything we saw in April. As I've said before, test results are one of the key indicators that we monitor closely. And we need to remember that those results depend a lot on who does get tested. No single day is indicative of a trend. Data trends have to be looked at over time and are crucial to our conversations about how soon we can start the process of reopening. That's why it's important to not draw too many conclusions from one day's data. Other data points we pay close attention to are the number of COVID-19 hospitalizations, the rate of hospitalizations among all COVID-19 cases, and the amount of COVID cases in intensive care units. There are currently 3,436 patients hospitalized in Massachusetts from COVID-19. That represents a reduction of about 126 patients compared to the previous day. There are approximately 850 COVID-19 patients currently in intensive care units, and I would just add that the intensive care unit capacity in Massachusetts is significantly above today what it would normally be, but that's because we worked with the hospital community to build additional so-called surge capacity in their ICUs to be able to manage the increase in COVID cases, which has turned out to be a pretty effective strategy in ensuring that our hospitals could do that as well as continue to serve people who are dealing with other healthcare conditions and circumstances as well. Over the past week, we have seen a steady reduction in hospitalizations. There are 280 fewer hospitalizations for COVID-19 patients than there were last Friday. Overall, about 5% of cases, which is a pretty consistent number, have been hospitalized. We're making progress here, but I want to remind everybody that the virus spreads quickly and continues to impact, based on our testing data, thousands of people across the Commonwealth. And while we'd like to see the drop come just as quickly as possible, it's not going to happen all at once, as the data shows. We've seen progress, and we'll continue to see progress as long as everybody continues to do their part. Another way we're continuing to push back against the virus is to pursue more personal protective equipment, or PPE. This includes masks, gowns, gloves, ventilators, and other gear for first responders, emergency management personnel, healthcare workers, and nursing home workers. As of yesterday, we've distributed over 9.2 million pieces of PPE, basically in the past 40 days, to hospitals, nursing homes, community health centers, cities and towns, and first responders across the Commonwealth. Overall, this week showed us some encouraging trends when it comes to our fight against the virus. And we know that everyone is anxious, and so are we, to move forward on bringing back the economy, and we all hope that we'll be able to start to take some of those steps soon. But at the same time, we did see individual days this week where the fluctuations in the data were less encouraging. That underscores the fact that the reopening process won't be instantaneous and will probably be done in an appropriately planned and phased-in way. There's no way you can just flip a switch, and doing so all at once could almost guarantee that we would have a huge spike in infections and more fatalities, the exact result we are seeking to avoid. Instead, we need to see the numbers continue to improve and to see that curve gradually slope downward. That will enable us to begin the phased approach to reopening that we've been talking about in the past few weeks. And even still, there will be bumps along the way after that. We're likely going to be dealing with outbreaks until things like vaccines and treatments catch up with this virus. We certainly expect that will happen. We have some of the smartest people in the world right here in Massachusetts that are making real progress on both treatments and vaccines, but that will take time. We need to stay committed to the fight, because if we let up now, we risk losing all the progress that we've made. Which brings me to the community health centers. Some of our most crucial partners in the fight against COVID-19 have been the folks who work and manage our community health centers here in Massachusetts. Today we're joined by Eliza Lake, who's the CEO of Hilltown Community Health Center in Western Massachusetts. Eliza is here to discuss what community health centers are experienced during the COVID-19 crisis, and she'll share an important message to patients who need medical care. And as we said before, we deeply value the role of community health centers. They're firmly rooted in the neighborhoods they serve, and they play an important role in facilitating access to care and reducing and eliminating healthcare disparities. That's why we've been proactive about partnering with community health centers in this fight against COVID-19. Last week, we announced that we had expanded our testing partnership with Quest Diagnostics and 18 community health centers throughout the Commonwealth. That partnership is specifically focused on increasing testing in many of our hardest hit areas, including high-density communities and communities of color. We recognize that many of these places continue to be hotspots for the virus, including neighborhoods in Boston, Worcester, Springfield, and municipalities like Chelsea, Brockton, Lawrence, Lowell, Revere, and Holyoke. Our COVID-19 Response Command Center continues to partner with the leadership in these communities to support a robust response to the virus. And the increased testing throughout the community health center system is a key part of that overall effort. Community health centers have always played a critical role in all Massachusetts communities in delivering health care. For example, Hilltown Community Health Centers has 5 sites offering a wide range of health services for communities across Western Mass. In a few minutes, Eliza will talk a little more about the terrific work that's being done by the team at Hilltown to support the residents of these communities during the crisis. And today we're here to help our community health centers make sure people know that they're open for business during this pandemic. The Mass League of Community Health Centers is launching a public awareness campaign called New Tools, New Rules, Same Great Care. This public awareness campaign will consist of TV and digital ads and has a very simple message. Community health centers are open during this crisis, and people should come in for the care that they need. The campaign makes clear that patients should continue to seek care for their medical conditions like asthma and diabetes at their local community health centers or their physician's offices. We know that these medical needs don't stop when the COVID-19 crisis begins. A few weeks ago, we had representatives from the hospitals throughout the Commonwealth join us here to encourage people to continue to call their doctor and to talk about their health care needs and to go to the hospital if they had an emergency. And believe it or not, after some of those engagements, those conversations, and those PSAs, people did start, in fact, to return. And at this point in time, in many of the conversations we have with our colleagues in the hospital community, they've indicated that slowly, but surely, they have seen people start to come back. Just like the hospitals, the community health centers have implemented measures to ensure that they remain safe and ready to care for all medical conditions. Community health centers have also worked hard to set up telehealth services so people can more easily connect with their healthcare provider. Simply put, and we've said this many times before, we planned for this, we are able to deal with it, we have the capacity. We do not want people getting sicker or exacerbating an illness or an injury because they're concerned about the healthcare system's ability to support them. It's important that people are cared for when they're sick, whether that's for COVID-19 or for so many other medical problems. The medical and health professionals who staff our community health centers are ready to serve and help patients who need care.